I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And my client Rose is 14 and has migraines, and you were describing neck pain also, right?
Yes, sir.
And how long have you had neck pain?
For about, I'd say, a year.
Anything cause it?
No, I don't believe so.
Yeah. Are you able to successfully treat it?
I have not tried to treat it yet.
But do you try to adjust your neck? I mean, do you try to get it to pop or something like that? I don't even like that word adjust, because a noise in a joint doesn't mean that the surface is lined up properly or that normal motion was restored. That's just not accurate. But what I found in looking at her neck is that the occiput lacks oblique motion. In the body of literature, you can read that the occiput can go into forward and backward bending on the first vertebrae. So we're talking about where the head connects with the top of the neck. So this is the back of the second vertebrae, and the back of the first vertebrae is more anterior, and we're talking about this area just right below the occiput. And the top two joints, I have my finger indented here, and I just don't know if the camera view can capture this, but it's curved in this direction, and it's also curved in this direction, okay? And then if we look at the back of the head, the occiput, then you can see I marked the joint in black, and so that's shaped similarly. It's a positive and a negative, okay? So we would call this surface convex in both directions, and we would call this surface of the first vertebrae concave. And of course you have that joint on both sides, okay? So the occiput at that joint can move forward and backward, so that's flexion and extension, or some people call it nutation and counter nutation. It can rotate, it can side bend, and there's a little bit of lateral glide when you side bend as well. What we do not find in the literature is it does not speak of an oblique movement. But it is possible, because in your spine, the most common developmental asymmetries of joint surfaces is at the L5-S1 in the low back. The second most common anomaly is abnormal development of joint shape or asymmetry from side to side is at the occipito-atlantal joint. And when I come and evaluate motion of that joint, the best place to do that is up in front of the mastoid. And I can push down towards the floor, and that would evaluate left rotation. Okay? But because I'm only doing it at that joint, and I'm well skilled in evaluating these small movements, and you can measure the amount of pressure you apply with a thumb gauge, and I'm applying less than 10 pounds of force. So my thumb comes on front of the mastoid, and I'm going to the left, and her head moves freely. I don't have to stabilize the vertebrae below that because I'm only inducing a very small amount of movement. The other thing I can do is I can put my index finger underneath the mastoid process, and I can test, and I can lift it up towards me using less than 10 pounds of force, and I'm testing side bending. Both of those movements are present when I test her on the right side and the left side. But there's this little hint that there's something that's not quite right. So I come down onto the transverse process of C1. C1 is also called the atlas, and the atlas is like a donut shape, okay? So this is the atlas, the first vertebrae in the neck. And out here is a projection called the transverse process. And when I come onto the transverse process of C1, I'm aware of more muscle tone on the right side. Now I push it off to the left and it moves. So the motion of C1 is good in side gliding. And I come underneath it and I lift up towards the ceiling, testing rotation, and rotation is free. The motion that is blocked is an oblique movement. So scoot over to the edge of the bed and then drop your elbow off the table. Beautiful. And your arm is out about 30 degrees. So if I come on the mastoid and I push towards her elbow, okay, at approximately a 45-degree angle, she has free mobility. Can you see that? The motion can translate in that joint and even beyond it. So scoot back onto the table. And now I come on the right mastoid and it's blocked. With that same amount of force pushing on my thumb, okay, stabilizing this pinch gauge and then pushing with my thumb, I'm pushing somewhere between 5 and 10 pounds, more like 8 pounds. That's the amount of force that I'm testing. If I tested with 30 pounds, you know, we would go well beyond that joint. We would be testing her neck moving. Okay, but because I'm limiting my force to about 8 pounds of force, then I'm isolating that first joint and it is distinctly stuck. What do you feel when I do that?
Just resistance, I guess.
Okay.
Nothing.
Alrighty. What do you feel on this side?
Movement.
Movement. Okay. Now I want you to do a movement. I want you to tuck your head and chin to the left at a 45-degree angle. Good. And just go small movements, real small movements. Very small, like that. And now do the same thing to the right. You can't do it. I'm watching you struggle. So it begs the question of could she restore that movement herself? And I don't know the answer. But the way to do it would be to do that very exercise, would be to try to get it to glide downward on the right. The assisted technique involves contact on the head, in front of the ear and above. So it's basically on the temples. And what I do is traction, just very slight. That's about 15 pounds of force. And I'm adding traction on both sides to get a little distraction of that joint, a little bit of gapping. And I wait about 30 seconds. And then what I do is I do a little scooping maneuver in an oblique direction. Okay, so I'm trying to get your chin to tuck down and to the left, as though you're side bending your head to the right and then looking to the right, looking downward to the right. Okay? So that's, of course, exaggerated. I'm using a lot less force. I'm just trying to isolate that first joint, and now I'm there, and I'm just doing this little movement, an oblique rotation, all right? And I'm just going to do that 10 times. I treated a 81-year-old man, and he injured his neck when he was 19 and had headaches since. And I treated him once. And my follow-up at 5 and 6 years later was he was still doing very well. Okay, so we did that 10 times or so. And then I come back, put my thumbs on the mastoids, and now we have movement. Can you test that movement, please? Looking down and to the right. Just real slight. How does it feel?
Like I can move it.
Good. Now cut that movement in half. Just go really slight, down and to the right. Nice. That's what I want. That's what I want. Okay? Mm-hmm. So fortunately, Rose's mother's here. She's filming. And so I will have her practice on me. And you just do the traction with the palms on the temples. Don't worry about the fingers. The fingers aren't really doing much. And you do a slight traction. Just pull up really slightly until the movement is taken up. And then you do this scooping maneuver downward to the left, as though there's an arc. There's an oblique arc, and you're following that arc. Okay? And I'm happy to have this opportunity to film this. It's, in a small way, me trying to get the word out there by posting these on YouTube on the topic of oblique restriction at the occipital or occipitoatlantal or OA joint. And thanks for letting me film you.
Mm-hmm.